welcome our doctor from Dalin City Hospital, Qiu Wenyan. Doctor, he worked for Dalin City Hospital at the Radiation Oncology Department. Dr. Qiu, this poster was done by Sister Kaixuan in Jiayi. And the words was written by Sister Kaixuan. And this is the team of our editing, from our editing team. They are our editors of posters. And you can see how beautiful our posters are. And they learn from each other, so their poster looks better and better. And Dr. Qiu, in the early days, he has already joined Dalin City Hospital. And Dalin City Hospital included traditional Chinese medicine into the treatment for cancer patients. And when doctors are entering into internship, before they enter in the internship, they could learn from the clinical trial and learn from their intern experience. So they put this what they've learned case by case into play, so that the patients would understand better how the treatment is working on to help the patients. And we do not understand the precision medicine. And when we want to advance in medicine and to benefit the patients more, we have to learn from Dr. Qiu. And the last piece of news is the true beam. The radiotherapy is one of the great options for cancer patients, because they don't need to have to cut their body open to create a wound to remove cancer tumor. But radiotherapy, you can use the radiation beam to kill cancer cells, and we can target the tumor, the location of the tumor with radiation beam, and to concentrate the radiation beam to the tumor, cancer tumor, so it will reduce the duration of treatment, and also will not create harm into the normal cells. I love to be with you because you have positive energy. And we welcome, it's our honor to welcome Dr. Qiu. And Dr. Lin was next to you in the video, and when you want to explain to Dr. Lin, Superintendent Dr. Lin, were you nervous? Dr. Qiu said he was nervous to make a report to Superintendent Lin, but he still calmed himself down and to make a great report. He drove to Kaohsiung. He was from Kaohsiung, and coming to Kaohsiung is like returning home to him. Although he now lives in Jiayi Dalin, and he's a young doctor, worked for Dalin Hospital, and he's from Kaohsiung. And his PowerPoint is very, very abundant information. in his PowerPoint. All his he also gave us his word-to-word speech transcript to our interpretation team. I appreciate what he has done. He makes so much effort to make our interpretation easier. Thank you. Thank you. I'm grateful to have this opportunity that when I got this, I was very nervous when I received this task that I'm going to be here to share with all of you. I was very touched. When we are going through this preparation process, I was very touched. When I'm making up this PowerPoint, I have to wait through very little, very detail into our process. So I got a greater review of this treatment process. And so I'm very grateful that I went through making up this PowerPoint. So I know what it made me feel even more confident in explaining to our patients how the treatment works. Last week, we mentioned about the precision. Last week, the precision was about how the patients who react, individual patients who react to differently to different drugs. But today, I'm going to talk about the precision medicine. It's about how precise you can deliver the radiation beam to kill the cancer tumors, cancer cells, and not to affect too much on the normal cells. And I am going to introduce the cancer treatment because the cancer is nowadays become the #1 cause of death in the past 39 to 40 years. So we are going to talk about how we treat cancers. We have to deliver the radiation beam to a very precise location to kill cancer cells, not to affect too much on the normal cells. And we can see that the lung cancer tumor, and when you breathe, the lung cancer tumor is continuing moving. And the tumor, the diameter of the tumor is only 1 centimeter, but the moving displacement of the tumor is 2 to 3 centimeters while we're breathing. So when we send in the radiation beam for the treatment, it has to cover around 5 centimeters to enclose the area of displacement of the tumor movement. So it needs to be very precise. The more precise our radiation beam enter our body, the less harm it creates on the normal cells. Which one is the radiation treatment? This only happened, the confusion only happened in Taiwan. In Taiwan, people call radiotherapy as electrical treatment with electricity. It's actually, there's nothing to do with electricity. On the right, on the left, is what you have done in physical medicine and rehabilitation treatment, and they do use the electricity wave on your body, so you would feel the electricity current flowing in through your tissues. But the radiotherapy does not use electricity current flowing through your tissues. Some of my patients refuse to receive the radiotherapy because they have the myth of that if they receive radiotherapy, they would feel hurt because they thought they could feel the electricity current flowing through their tissues. But actually, no, they wouldn't feel the electricity current flowing into their flowing through their tissues. So there are the radiotherapy is about 100,000 times stronger than the X-ray, and of course it will create it will kill cells, but that's why we need to improve our precision, because if the more precise we deliver the radiation beam, the less harm it creates on normal cells. So we could improve the survival rate of cancer patients, and also we could improve the progression-free rate for cancer patients. And patient won't be able to see the radiation beam. It's not visible for human eyes, and the patient don't feel anything. And some patients are even curious why they doubt why they don't feel anything. Do they really receive treatment? Yes, you don't feel anything while during radiotherapy. For the myth about radiotherapy, some people they say that they have the myth that they after they receive radiotherapy, they couldn't hug their small children, because they would emit radiation to their children. No, that's not true. You won't emit any radiation after the radiotherapy, and you won't have any radiation residues on your body after the treatment, and you won't feel the whole body discomfort after radio treatment. And in the old days, we have the cobalt 60 treatment for the cancer patients, and through the progress of the advancement of the modern technology, and nowadays we have the 3D and 4D treatment. We can make an analogy between the war between Ukraine and Russia. When they drop the bomb, they need to be more precise to a certain location, so that the bomb won't create too large number of casualties for the civilians. Now the rapid arc technology and is quite precise, And it's not like the 3D, the early age of 3D treatment. It's like shotgun. It still killed a lot of normal cell, but nowadays the whole body 3D navigation, it would be more precise. And we could monitor the breathing cycles, and they could hold the breath after the deep breath. And so we can shrink the affecting area of the radiation beam. And we would before the treatment of radiation therapy, they would the physicians would give their patient breathing training, so they know how to take deep breaths and hold the breath and exhale, control. And let's take a look at this. When the breathe up and down, inhale and exhalation, and we monitor the cycle of the breathing, we can also precisely control the location of the radiation beam entering the body. And we also use auditory feedback and sight feedback. We use the AI and AR for patient to be able to see and to see how the treatment entering in their body and how the radiation beam entering in their body. While they breathe, they could also monitor their own breath cycle. And the traditional image navigation system, we cannot precisely locate the image, but now the 4D control, the description being computed tomography system is a modern technology that they could rotate around the patient and to catch the precise location of the tumor. And we include.
And let's talk about some cases that I have treated, and so you can have a better understanding about this radiologies. So for the early stage of cancers, for example, the early stage of lung cancer and liver cancer, radiation therapy can be used instead of surgeries through the breathing control and the adaptive therapies, and the treating effect could be significantly improved and with very little side effect. But if you don't know about the skill, the patient will be scared. They just let it happen like this. They won't do anything about it. For the early stage of liver cancer, say the little circle on the upper left-hand side, and after the treatments, after the radiation therapies, the tumor can be completely disappears. And for this kind of a tumor is already grow into 6 centimeters. So after the 5th time of radiation therapies, the tumor is almost disappears. And it has a great effect for this kind of tumors. So before, people always thinking about after the radiation therapy, they will have the pneumonia or any infection. But nowadays, with this advanced technology, we can reduce the side effect. And for this, the primary liver cancers, and doctor told him that it's too late to perform a surgical resection, and even embolization is not possible to be done. So after we perform the radiation therapies, 1 month after the treatment, the size reduced 88%, and it has been 32 months. You can see the size of the tumor has reduced more than 99%, and the side effect is slightly fatigue. And for this patient with large liver cancers and the liver cancer with portal vein obstructions. So through the precise technology to increase the radiation dose and can effectively control the tumor. And for this patient, this patient, the cancer cell already metastasized to his lungs, but the location is very close to the heart and his ribs. Because it is very difficult to perform a surgical resection, but through our advanced technology, the precise radiation therapies, now you can see after the therapy, the tumor completely disappears and there is no side effect. And in this image, the cancer cells has relapsed. So before the treatments, it was very close to the ribs, but after the therapy, the tumor completely disappears. So that means the disease already gone and the problem is solved. And such as one of my patients, especially in the middle of Taiwan, and this person, Mr. Wang, he's an apple farmer. He was suffer from oral cancer and was caused by the tobacco, alcohol, and bitterness. But after various treatments, the primary site was finally controlled. But during his follow-up, we find out that the cancer cell already metastasized to the lungs. And maybe at that time, we diagnosis is the stage 4 lung cancers. And as the image, you can see there's a 3 centimeters tumors that was very close to the LDART. It's inoperable, and it was. And through the precise radiation therapy, the metastatic tumor completely disappeared after the treatment. Now he's able to return back to work. And we also have the patient. He was suffering from pain, but the tumor was still growing and metastasized to bone, and it's extremely painful. And we can perform the radiation therapy and adjust the doses simultaneously according to the patient's condition. And now after the therapy, even the bone was regrowing. And this is a breast cancer patient. And he has a wound and it was inoperable. So the wound need to change dressing several times a day, and it was extremely painful. There's no other way to do it. And for us, we can perform the radiation therapies. So after the treatment, the skin starting to heal, and now she only need to change dressing once a day. So not just to cure the cancer, we also need to control their side effect. And let's look at this patient's feet. He's suffering from diabetes for years, and it caused a poor blood circulation in the feet. And there were tumor cover all over under his feet. And we did a biopsy. It's not just ulcers. It is a Kaposi sarcoma malignant tumors. And if we perform the surgery, maybe the patient will end up with amputations. So we need to monitor this simultaneously when we perform the radiotherapies. As you can see, we draw lots of lines under his feet because we're adjusting the radiation positions. So we modify the treatment simultaneously according to the patient's skin conditions. So 5 months later, the tumor disappeared and the skin returned to normal with no wounds and no hardening of the skin. So this is all rely on doctor's treatments. So every day I visit this patient and adjust my treatment simultaneously according to the patient's condition. So now he can also resume to his work. So through the improvement of these medical technologies and continuous refinements, such as the doctor as ourselves, we need to continue training ourselves to learn the advanced knowledge to improve ourselves. And in addition, the Dalin also introduced proton therapies, which is also the type of radiations. And the proton therapy can be used on the patient who is hard to be treated and also recurrent many times. The proton therapy has a great effect. So in the future, we would like to create a world that has no fear of cancer. So, and also we are not just to cure their disease, we're only taking care of their mental problems. So we need to perform precisely mental treatments. So this is called holistic healthcare. Just like the patient check into our hospitals, they usually visit many different departments. They had to running around in the hospitals. So we decided to simplify the check-in process. So the patient only needs to use the barcode to scan the barcode so he can check in immediately to reduce the human error, also improve this personal privacies. And usually inside of the treating room, because the equipment need to be kept in the cool environments. So every time patient come to the treating room, he always complain about it is so cold. So we provide blankets and also a thicker, more thicker patient treatment gown to keep patient warm, and patient can feel more comfortable during treatments. And during treatment, we can also perform the chemotherapy and radiation therapy that can combine together. And we will have the nurse to give them a health education and to train dressing for them. And some of the patients say some of the patients they're older and they might not able to walk, so they have to go to the dressing room to change the dressing treatment gowns. And we install a lot of handrail inside of the treating rooms. So we also design the emergency belts, the wireless emergency belts that the patient hold it in her hands. If she encounters any discomfort, she can report it to us right away. So with all these developments, we want to invention patent certification in Taiwan. And not just patient receive a good treatments, and also we made a good affinity with the patients. So our electronic information system has also obtained patents and technology transfer to manufacturers. And as this video, you can see the cancer patient also worry about the infection and the hospitalizations. And such as my patient suffer from esophagus cancers, and after the tumor was cured, but because the immune system was decreasing, so he passed away. So all of this treatment before she passed away is actually not necessary. So for the elderly patient who was infected as a pneumonia, we actually conduct the research on other problems of cancer patients, such as infection and pneumonia. We have to conduct a research the protective effect of the vaccine on cancer in the elderly, and find out that the protective effect is still very good. So we still encourage patients to get the pneumococcal vaccines and to reduce the pneumonia's occurs. So through all of this process, we always think about what patient needs, and we can provide them. We can provide a treatment place for the love. So once they step inside the treatment room, they were surrounded by love. And thank you for listening. We really appreciate Mr. Dr. Yan. He even finished his presentation before the time's up. So through the presentation, do you feel that that was very touching? And as you can see the presentation in his PowerPoint, there's some cuffs and the patient coughs, so the sleeve will not fall down. They will just start with your thumb. So like before, when I entered the operation room, it was extremely cold inside of the treatment rooms. So under this environment, it is very cold. But what I remember is at that time, there was no heating lamp. But is that only in Dalin, Ziji? The doctor say not all of the operation room or the treatment room has the heating lamp. Like for myself, I really feel very cold even before the operation started. But there's nothing we can do about it. So we can say that Tzu Ji is very soft, for that we offer the heating lamp and the thicker treatment gauze. And the feedback from our other friends. So I did not realize that the cancer can be metastasized to the other places. Thanks to Dr. Qiu Wenyan to give us such a professional introductions. And also his presentation is very excellent and very detailed. Let's give him a big hand. And also the other feedbacks. Lots of patients suffer from cancers, and it was very challenging to receive the radiation therapies. So lots of time when we receive the therapies is to ease the pains. It's not just to cure the disease, but we also take care of their quality of life. So, and the other feedback, the knowledge, the medical knowledge always refresh our memory, always let us learn a lot of things about the disease and how the advanced technology can help us in the future. We really appreciate him. He's very precise and very knowledgeable presentation. Thanks to Dr. Qiu Wenyan give us such a professional presentation. Thank you, everyone. So don't be nervous, we are all whales. So as you can see from the presentations,